Are you pregnant and on antidepressants? The choice to continue SSRIs, or selective serotonin reuptake inhibitors, while pregnant is not easy. Hi, if you're new to my channel, I'm Dr. Brian, retired obstetrician and founder of Health Without Risk. Depression and anxiety affect 1 in 5 pregnant women. Only 5% take antidepressants like SSRIs while pregnant. A recent Wall Street Journal article highlights the heated debate. Should pregnant women take these medications, stop them, or avoid them entirely? Let's review both sides of this important debate. Perinatal depression can be serious. It's the leading cause of pregnancy-related deaths in the U.S., often due to self-harm. Some experts argue that for severe depression, SSRIs can be life-saving. Recent studies show minimal risk when controlling for factors like depression severity. Benefits include better maternal mental health, improved prenatal care, and stronger bonding with your baby. Doctors note that untreated depression can lead to preterm birth, miscarriage, poor self-care, risks similar to those blamed on SSRIs. For women with moderate to severe depression, continuing or starting SSRIs may outweigh potential downsides. On the other hand, critics view SSRIs as a chemical exposure risk. These drugs do cross to the placenta, potentially affecting fetal brain development. Studies link SSRIs to a small increase in premature birth, miscarriage, and neonatal adaptation syndrome, where 25 to 30% of exposed newborns experience temporary jitteriness or respiratory issues. There's also a rare risk of newborn pulmonary high blood pressure and maternal postpartum hemorrhage. Animal studies raise concerns about long-term developmental effects, although human data less clear. Critics argue we can't fully know the risks without unethical clinical trials. There is no perfect choice. Untreated depression carries risks, but so do SSRIs. About half of women stop antidepressants during pregnancy, risking relapse. For mild cases, therapy or lifestyle changes might suffice, but severe depression often requires medication. The decision hinges on individual factors: your mental health history, the severity of symptoms, and your values. Experts agree shared decision-making with your doctor is vital. Resources like Drugs in Pregnancy and Lactation can provide detailed, evidence-based guidance. When I was practicing obstetrics, I often turned to Drugs in Pregnancy and Lactation for guidance on medication safety. It's a resource informed by the pioneering work of my colleague, Dr. Jennifer Niebel, who is chairman of the Department of Obstetrics and Gynecology at the University of Iowa. Her research on drugs like antidepressants and treatments for nausea in pregnancy helped shape evidence-based approaches that I use to counsel patients, emphasizing caution due to the lack of definitive safety data. My approach was cautious. No medication, even over the counter, can be deemed absolutely safe in pregnancy due to ethical limits on testing. While some drugs like anti-seizure medications were essential, others, think statins, could often be stopped. SSRIs fall in a gray area, crucial for some, but maybe not all. If you are pregnant and facing this choice, talk to your doctor and review information from sources such as Drugs in Pregnancy and Lactation. It's a comprehensive guide to help you make informed decisions about SSRIs or any medication. Your health and your baby's matters. Stay informed, email me if you have questions, and thanks for watching. Bye.